Welcome back, all of you, to Nursing Officer Exam Preparation Mock Test Explanation Series Part 50 for various central government exams like RRB, AIMS, JIPR, UPSC, etc. The first question: in management process, the inventory that expires or loses its value over time and eventually become worthless is termed as option A, perishable item, option B, non-perishable, option C, furnitures, and option D, equipments. Let us see the right answer. The right answer here is option A, perishable items. Perishable inventory refers to items that loses their value or expire over time. Like food or certain medications eventually become worthless if not sold or used before their expiration date. So, perishable inventories, non-perishable inventories. You have to see here the inventories which loses their value over time is perishable, and it will not lose the value means it will be non-perishable inventories. Next question: a test used in an exam of neurological function or for balance, test, proprioception, vestibular function and vision is option A, Romberg test, option B, Rothera test, option C, Rubin's test, and option D, red reflex test. Let us go to the right answer. The right answer is option A, Romberg test. Romberg test is the test used in an exam for neurological function for balance, test, proprioception, and vestibular function. Here the other tests also similar in appearance or pronunciation, so be very careful to avoid confusion in exam hall. Let us see the other tests also. Rothera test is for presence of acetone and acetoacetic acid in urine. Rubin's test is the test for the patency or occlusion of fallopian tubes. Then red reflex test is a non-invasive eye examination. Next question: filariasis is caused by option A, Wuchereria bancrofti, option B, Plasmodium vivax, option C, Toxoplasma gondii, and option D, Bartonella quinta. The right answer here is option A, Wuchereria bancrofti. So this is the organism or parasite. Filaria is caused by parasitic worms called filarial nematodes, with the most common being Wuchereria bancrofti, transmitted to humans by mosquitoes. It is a vector-borne disease transmitted from the source to human being by a vector mosquito. Next question: abulia is the condition in which there is option A, lack of speech, option B, selfless attitude, option C, release of excessive emotions, and option D, absence of willpower. Let us see the right answer. The right answer is absence of willpower. Abulia is a neurological disorder characterized by a profound lack of will, drive, or initiative, leading to apathy, slowness of thought, and difficulty to initiate or complete goal-directed activities. So, these terms abulia, aphaemia, avolition, all those kind of words will be similar looking. You have to be very careful. We will go for more questions similar to like this in this session. Let us go to the next question. The ethical principle of telling truth is known as option A, fidelity, option B, confidentiality, option C, veracity, and option D, justice. The right answer here is option C, veracity. Veracity is the term which is telling the truth or facts. Fidelity is being loyal or faithful. Fidelity means being loyal or faithful to self and others. Then confidentiality means keeping the secrecy, because when nurses are getting the disease information from the patient file, it should be kept confidentially. Confidentiality is the patient right. Veracity is telling the truth or fact, and justice, as you all know, it is the fairness or impartial attitude. Next question. A psychoanalytical term for relieving an experience to purge it of its emotional excesses. A type of catharsis is option A, abulia, option B, abreaction, option C, alogia, and option D, anhedonia. The right answer here is abreaction. Abreaction is a kind of catharsis where you will be relieving some emotional excess. That is abreaction, which is similar to catharsis. Then the other terms we will see, all are similar terms. It can cause confusion. Be careful about these terms in exam hall. The abulia is the first term. Abulia is lack of will. Alogia, it is related to language or speech. Alogia, you can connect it. Poverty of speech is alogia. Abulia is lack of will or initiative. Anhedonia is inability to feel pleasure. A person cannot enjoy the normal enjoyable moments. It is anhedonia. Next question. The type of leadership style where the leaders seeks opinion and suggestions from followers in management process is option A, authoritarian, option B, laissez-faire, option C, bureaucratic, and option D, democratic. Right answer here is option D, democratic. Democracy, the democracy is the word where it can indicate the people's opinion also. People's right, people's opinion also will be considered. So this type of leadership is democratic leadership, and the other types you can see, authoritarian is absolute control over the management. Here it is just like kingdom. You don't have the right to answer, to question, or to get the answers from the authority. What they say, you have to implement or follow. That is authoritarian. Then laissez-faire is some kind of democratic kind of leadership. Here minimal guidance only will be given, and you can just give your input and work autonomously. Bureaucratic leadership is a structured, for example, it is in policing or civil service. So the structured kind of management style, that is bureaucracy. So these all are the different type of leadership styles. Next question. The disease that is known as whooping cough is option A, meningitis, option B, tuberculosis, option C, diphtheria, and option D, pertussis. The right answer here is option D, pertussis. Pertussis is also known as whooping cough. I am adding more images here with this kind of questions to connect in your memory. So remember this picture, pertussis is whooping cough. Next question. By which process glucose is transferred to the fetus? Option A, simple diffusion. Option B, facilitated diffusion. Option C, pinocytosis. And option D, active transport. The right answer here is facilitated diffusion. The glucose is transferred to the fetus by facilitated diffusion. Remember this picture. Next question. The inability to perform rapid alternating movements of muscles is option A, ataxia, option B, adiadochokinesia, and option C, akathisia, option D, abolition. The right answer is adiadochokinesia. The other terms also we will see. Ataxia is loss of balance or lack of getting balance. Then akathisia is the inner restlessness. A person cannot sit quiet. There will be inner restlessness. Avolition is the lack of motivation, of lack of initiating self-activities. Next question. Brief description of events or situations to which respondents are asked to react and provide information about how they would handle the situation described in research is option A, Q sorts, option B, weakness, option C, semantic differential scale, and option D, ecologic momentary assessment. The right answer here is option B, wingnet. Wingnets is the other term for hypothetical scenario. So there will be a brief description of events or situations to which the respondent or the interview applicants are asked to react and provide information about how they will handle. The ideal typical example is ACLS mega code of ACLS scenarios. So they will ask you, there is a cardiac arrest, how you will act. They will ask you to demonstrate or explain. So this kind of hypothetical scenarios is otherwise termed witness. Next question. Complex spots is seen in option A, chickenpox, option B, mumps, option C, measles, and option D, rubella. The right answer here is option C, measles. Complex spots, you can see the figure here. These complex spots are seen in measles. Next question. What is the nurse-patient ratio in an intensive care unit of a hospital as per Indian Nursing Council? Option A, 1:1, option B, 1:2, option C, 1:3, and option D, 1:5. Let us go to the right answer. The right answer is option A, 1:1. This kind of questions are not very accurate questions, but you have to select the most appropriate answer among these options. Because here the ideal standard nurse to patient ratio in intensive care unit is generally 1:1 for ventilator cases, and for non-ventilator cases it is 1:2. So if there is both these options are there, you have to select the first option, like 1:1, meaning one nurse is responsible for 1 or 2 patients. Next question, the scale that assesses the risk of bed sores is option A, Braden scale, option B, GCS scales, option C, AVPU scale, and option D, GEOP scale. The right answer here is option A, Braden scale. Braden scale is for bed sore. GCS scale is for the level of consciousness, and AVPU is also for the same. Then GEOP scale is the Children's Pain Assessment Scale for post-surgery. Next question, which among the following is a written defamation? Option A, slander, option B, assault, option C, libel, and option D, battery. The right answer here is option C, libel, which is a written defamation. Slander is a verbal defamation. Assault and battery, option B and D, you can see the differences. Assault, only a threat, no physical contact is involved, and in battery, the physical contact is also involved. Next question. Smallpox is eradicated as declared in World Health Assembly in the year of option A is 1976, option B 1980, option C 1989, and option D 1992. The answer here is option B 1980. You have to be careful because India declared itself, like India declared us themselves as free of smallpox on April 23, 1977, but the global eradication was certified in 1980. So this is officially recorded. India declared itself free of smallpox on April 23, 1977 after an intensive eradication campaign, although the last naturally occurring case in the world occurred later, and the global eradication was certified in 1980. So if 1977 is there for this question, it is not the most appropriate answer. The answer will be 1980. Be careful. Next question, recruiting all the people from an accessible population who meet the eligibility criteria over a specified time interval or for a specified sample size for research is a sampling. Option A, cluster. Option B, stratified. Option C, systematic. And option D, consecutive. Right answer here is option D, consecutive. So, recruiting all the people from an accessible population who meet eligibility criteria over a specified time interval or for a specified sample size for research is consecutive sampling. Here you can see the other two types as cluster sampling versus stratified sampling. Cluster sampling is a type of probability sampling in which a sample is randomly chosen from the naturally occurring cluster by the researcher. So it will be selected as clusters. But here stratified sampling involves creating homogeneous groups or strata within the target population and randomly selecting a sample from each segment. So here is stratified, they are creating separate homogeneous groups. But here in cluster sampling, it will be selected from a naturally occurring cluster. So this is the difference between cluster and stratified sampling. Next question. The disease in which pleomorphism is seen as a complication Reye syndrome developed is option A, rubella, option B, bird flu, option C, smallpox, and option D, chickenpox. Right answer here is option D, chickenpox. Pleomorphism is the condition where the occurrence of more than one distinct form of a natural object like virus is present. That is pleomorphism. To more than one form. Here, Reye syndrome can develop as a complication of chickenpox. So this answer will be chickenpox. Chickenpox will show pleomorphism and Reye syndrome can develop as a complication of chickenpox. Next question. Which is the most commonly used inhalation analgesia in labor? Option A, Eltonox, option B, nitrous oxide, option C, metazinol, and option D, diamorphine. Right answer here is option A, Entonox. The most commonly used inhalation analgesia during labor worldwide is Entonox, a 50:50 mixture of nitrous oxide and oxygen, also known as laughing gas. Next question. The mucosal folds of small intestine starting from the second part of duodenum. Option A, Petra, option D, Cullet, option C, omentum, and option D, plica. Right answer here is option D, plica. These are the circular mucosal folds of small intestine, which is called as plica. Whale's disease is option A, scrub typhus, option B, leishmaniasis, option C, leptospirosis, and option D, giardiasis. The right answer here is option C, leptospirosis. Whale's disease is leptospirosis. Next question. The inability to initiate or engage in goal-directed behavior. Option A, avolition. Option B, upreaction. Option C, altruism. And option D, ambitendency. The right answer here is option A, avolition. Avolition is the inability to initiate or engage in goal-directed behaviors. Upreaction is a type of catharsis where the person is experiencing the emotional surge, expressing the emotional surge, ventilating. That is upreaction, a type of catharsis. The altruism is the selfless attitude. They will have more concern for the wellness of others than self. Ambitendency is the tendency to act in an opposite way actually what he feels. That is ambitendency. Next question. Which of the following scale is not a scale to assess the level of consciousness? Option A, Grady Coma scale. Option B, Glasgow Coma scale. Option C, Stanford Binet scale. And option D, ABPU scale. Not a scale to assess the level of consciousness. The right answer is Stanford-Binet scale is not a scale to assess the level of consciousness. It will assess the intelligence. It is Stanford-Binet scale for intelligence. Brady's comma scale, Glasgow comma scale, these all are the GCS, like level of consciousness scales, and the VPO scale is also assessing the level of consciousness. So these three scales are for level of consciousness, and Stanford-Binet scale is for intelligence. Next question. The purpose statement in research should identify the study variables and option A, design, option B, data collection tool, option C, statistical method, and option D, population. The right answer here is option D, population. The purpose statement in research should identify the study variables, population, methodology, and the goal or intent of the study itself. So the right answer here is population. Next question. This is the last question of this portion. The appearance of a neonate is body pink and extremities blue. What will be the Apgar score for that? Option A 0, option B 1, option C 2, and option D 3. The right answer here is option B 1. You can see here the Apgar score on various parameters. A appearance, B pulse, G grimace, A activity, and R perspiration. Here they are mentioning about the appearance. 0 point is blue and pale. 1 point is for body pink and extremities blue, and 2 points for pink. Here it is mentioned extremities blue and body pink. So the point will be 1 for appearance. So the right answer is option B 1. So we are winding up the session with this question today. Thank you all for watching this video. Please like, share, and subscribe for more exam preparation videos.